Hi, this is Dr. Sherry Shabowski from Medical Education in Minutes. This is part of our classic clinical presentation series. And today we're going to meet Gale Blodder. Say hello to Gale Blodder, a 40-year-old mother of two who has been having recurrent cramping abdominal pain after meals for quite a while. She went to the doctor to check it out. She tells the doctor, "For the last few months, I have been feeling very gassy and nauseated after fatty meals. And I frequently get severe cramping epigastric pains too. But typically they go away after a while and then I feel fine." This time, the same thing happened after we ate fried chicken. It started the exact same way. But this time the cramps were much more severe. And over the next few hours, my belly became very tender and I started vomiting green stuff, so I came in. On the evaluation of the patient, you find that she's a little bit tachycardic and she's breathing a little quick. She has a low-grade fever, and the doctor finds her to be very tender in her right upper quadrant. Her white blood cell count is 16,000, which is much higher than the normal 12,000. Her liver enzymes are normal and her lipase is normal. What do you think the next step should be? Well, in this case, the next step is an ultrasound. Ultrasound is an excellent tool for the evaluation of the gallbladder, which is where she is having pain and tenderness. There's no IV contrast, no radiation, and it's relatively very quick. In fact, most ER doctors can do it at the bedside. Before we go any further, let's consider the anatomy and pathophysiology in this region so we know what we're looking for. Here we have a picture of the anatomy. Liver up top, right under the right ribs. Snugged up under the liver, you find the gallbladder. To the side of it, you find the pancreas. These three structures put a lot of digestive juices into the duodenum in order to digest your food. Gale had gallstones for quite a while. They were squeezed out with the bile after fatty meals, causing her that colicky pain that she was describing as the stone made its way through the muscular cystic duct that comes from the gallbladder and moves the stone into the duodenum. It caused nausea along with severe pain until it passed. Once the stone passed into the duodenum, the pain was gone. This time, the stone was just too big, and it got stuck in the cystic duct. The obstruction results in gallbladder swelling, followed by inflammation of the gallbladder and its wall. This is called cholecystitis. It causes systemic symptoms like nausea, bilious emesis, fever, and an elevated white blood cell count. All the symptoms that we're seeing with Gale. This mnemonic is not particularly PC, but it works. The classic example of gallbladder disease and who is most likely to get gallbladder disease is recalled with the mnemonic the 4 Fs. Those 4 Fs are fat, fertile, 40, and female. And again, in this case, classically, those things do actually describe Gale. Now let's go back to the bedside. It is confirmed you have cholecystitis. We are giving you antibiotics and pain medication, but you will need an operation to remove your gallbladder. Gale becomes quite concerned. Don't I need my gallbladder? The doctor answers, your gallbladder concentrates bile, and squeezes it out during fatty meals. You had pain after fatty meals because you were passing stones. Without your gallbladder, bile will come directly from your liver. We have been removing gallbladders for years, and people do well. If you don't have it removed, you are likely to get much worse, and truly you could potentially die. So I strongly suggest a cholecystectomy for you. In a cholecystectomy, the cystic duct is cut and sealed, and the gallbladder is removed in the operating room. 1 week later. Thank you, doctor. I feel so much better. Again, this is Sherry Shabowski from Medical Education in Minutes. I hope you enjoyed this classic clinical presentation, and I hope to see you next time. Keep studying.